Doris L. Wethers, Black Pediatrician. Doris Wethers was a major force in developing and expanding programs to help professionals and the public deal with sickle cell disease in children. The second Black woman to graduate from Yale University School of Medicine, Wethers went on to become founder and director of the Comprehensive Sickle Cell Program at St. Luke's Roosevelt Hospital Center in New York, and a professor of clinical pediatrics in the College of Physicians and Surgeons at Columbia University. Throughout her career, Wethers served on advisory boards, participated in educational and service networks, and worked directly with inner city patients to encourage infant screening and treatment for sickle cell disease. Doris L. Wethers was born in Passaic, New Jersey, to Lillian Wilkinson Wethers, a schoolteacher, and William Wethers, a physician with a family practice. After World War II, her family moved from New Jersey to New York City, just outside central Harlem. Her father's office was on the ground floor of their home, and Wethers was exposed to her father's medical practice throughout her childhood. According to Wethers, in a telephone interview with contributor Ellen Coffran, she and her sister Agnes accompanied their father on his house calls. A compassionate and much loved physician, William Wethers set an example of professional service, which young Doris mimicked by setting up her dolls in sick wards around her room. She always wanted to be a doctor. In 1948, Wethers graduated from Queens College with a major in pre-medical biology. She completed medical school at Yale in 1952 and was granted her New York state license to practice medicine in 1953. By 1955, she was chief resident of pediatrics at Kings County Hospital in Brooklyn, New York. Wethers spent the first 10 years of her career caring for children in her father's office. During this time, she treated many diseases that stem from poverty, including lead poisoning, tuberculosis, drug dependency passed from mother to baby, and premature births due to poor prenatal care. At the end of this period, she developed a particular interest in children with sickle cell disease. According to the Sickle Cell Disease Guideline Panel, on which Wethers served in 1993, sickle cell anemia is a potentially fatal genetic condition which affects about 1 of every 375 African American infants. Wethers left private practice in 1965 to join a health maintenance organization, a move that allowed her to continue seeing patients directly while branching out into administrative and educational work aimed at her special interest. Between 1965 and 1979, she acted as director of pediatrics at 3 New York hospitals consecutively: Knickerbocker Hospital, Sydenham Hospital, and St. Luke's Roosevelt Hospital Center. Beginning in 1979, she began to concentrate more on sickle cell research. She founded the Comprehensive Sickle Cell Program at St. Luke's Roosevelt Hospital Center and became its director. During this period, she also began teaching, and in 1987, she was made professor of clinical pediatrics in the College of Physicians and Surgeons at Columbia University. Wethers was also a consultant to numerous organizations around the country. She served as director of pediatrics for the Manhattan Medical Group from 1983 to 1992, as chair of the GENES Sickle Cell Advisory Committee from 1978 to 1992, and as reviewer for the American Journal of Pediatric Hematology and Oncology. She was a member of the Sickle Cell Advisory Committee of the Department of Health and Human Services Agency from 1982 to 1986, the American Academy of Pediatrics Committee on Careers and Opportunities from 1989 to 1995, and the Council of Regional Networks for Genetic Services beginning in 1993. In recognition of her extensive clinical and research work, she received the St. Luke's Roosevelt Hospital Center Community Service Award in 1993, the Charles Drew Memorial Award from Columbia University College of Physicians and Surgeons in 1984. She was also named Preceptor of the Year by the New York Health Research Training Program in 1991. Wethers' work has touched the lives of many patients whose economic circumstances would have prevented them from receiving comprehensive care for a disease as dangerous as sickle cell anemia. She inherited the compassion she so much admired in her father and carried it through her long and distinguished career, balancing her administrative duties with hands on care for patients from newborn to teenage years, and serving as a mentor and role model for patients and students alike. Married in 1953 to Garville H. Booker, a dentist, Wethers raised three sons. She lives in New York City. Citations are in the description.